You're not feeling well, or you're feeling feverish. You have a cough. Many of us will not even reach out to a doctor, instead possibly pop in an antibiotic. And that is just one part of the problem. Before I get to the other, for which even doctors are responsible, let's look at this latest study by the National Center for Disease Control. 55% of antibiotics are prescribed for prophylaxis, which is, in simple words, for prevention rather than treatment. 57% of antibiotics used were from a category prescribed for extremely sick patients. Barely any difference between ICU patients and normal ward patients. At least half of the 10,000 patients surveyed at top or tertiary care hospitals across 15 states paints a very worrying picture. And this involves doctors as well. Now, why should you and I be worried about this? According to a study by University of Washington, in India, around 3 lakh deaths were possibly due to antimicrobial resistance. In simple words, you and I have overdosed so much on antibiotics that bacteria, viruses, parasites no longer respond to it. And deaths then cannot be averted in critical cases. I'm using the word you and I in a very generic term. But this is a huge issue, possibly affecting many. But this is as simply as we can really put it. I'm being joined right now by some very eminent voices to help us understand this better and deeper without any hype or hysteria. Let me introduce my panelists. Dr. Sanjeev Bagai, he's the chairperson for Nephron. Dr. Rahul Pandit, the chair for Intensive Care Unit at Sir H.N. Reliance Foundational Hospital. Dr. Trupti Gilada, who's an infectious physician, Unison Medicare and Research Center in Mumbai, as well as Dr. Rajiv Jayadevan, co-chairman, National IMA COVID Task Force. Thank you very much, all four of you, for joining us on this extremely sensitive issue. Let's just straight dive deep. And possibly, maybe I could just take this question first to Dr. Rajiv Jayadevan. This is a survey by a government body among tertiary care hospitals, which means higher chances are that you and I, our audience, would possibly be very similar to the sample that was surveyed. Kindly explain to our viewers, why is this NCDC survey so important as a sample for what's happening in India?
An audit is an important tool in finding out exactly what is happening. For instance, there are different categories of antibiotics which have to be used for different severity of infections. For example, a simple case of sinusitis does not need an extremely powerful antibiotic if treated in the community. But in a patient who develops the same problem inside a hospital might require a greater degree of a greater level of antibiotic support. So this is a complicated topic, and the survey essentially shows that the pattern of prescribing antibiotics in a tertiary care center tends to be on the higher level. But what we must focus is to educate the healthcare community that all infections need not be treated with high or powerful antibiotics. Now, I mean bacterial infections. Now, for the most part, I heard you mention the term fever. Most fevers are viral in origin, and that is really where the doctor's clinical judgment comes in. No fever must be treated with antibiotics without a clinical judgment coming in. In other words, people have the habit, especially in our country, of popping antibiotics just because a doctor prescribed it somewhere or their colleague in the office advised them to do so. That is wrong. That is the first thing we have to stop. Over-the-counter use is rampant in India. People purchase antibiotics just like purchasing oranges and grapes across over-the-counter. This is not possible in any developed nation. So there are several areas of improvement, but the NCDC survey tells us that antibiotics need to be categorized according to their power and used according to clinical discretion.
Right. In fact, Dr. Sanjeev Bagai, if I can ask you this, a lot of times in the past also, there have been discussions around AMR. Now, my point, or overdosage of antibiotics, but a lot of it has been around patients popping these pills, the OTC availability. Just how important is this NCDC survey that really now focuses on what's happening inside hospitals with doctors?
Good evening. So I think this is just a very small example of a very large malice which is lying underneath. Antibiotics for decades in India especially have been used, overused, they've been abused. They've been used in combinations, they've been used for every and any fever without indication. And worst of all, antibiotics of every grade, oral and IV, are available across the counter without a prescription, without a validated prescriptions. And patients themselves tend to use it. We've seen lots of cases which come to the hospital with self-treatment, and ultimately then it is something which becomes of very high mortality and morbidity. The fear of this chronic abuse of antibiotics, either in singular or in combination, is not only having antibiotic resistance, what we call as AMR, antimicrobial resistance, but overgrowth of other opportunistic infections and multi-drug resistant strains, what we call as superbugs. And I'll give you just two classical examples because of want of time. We've reached a stage now of multi-drug resistance tuberculosis. We've reached a stage of multi-drug resistance gram-negative infections in the ICUs, which carry more than 90-95% mortality, and the famous MRSA, which is resistance to most other antibiotics. I think the three-prong attack which is required is that the doctors must be educated at all levels, right from GPs to physicians to critical care and further down, at all levels of medical fraternity, as to rational use of antibiotics as a policy, one. Two, pharmacy is still the most
Sanjeev,
unstructured and unsurveyed sector in India.
Oh, Dr. Sanjeev, both the points that you have mentioned are important, but let me just come and let me get the introductory remarks from others as well. Dr. Trupti Gilada, let me just take it over from what Dr. Sanjeev was saying, and he was talking about the importance of educating doctors. Now, what baffles me, despite whatever I have reported and understood about issues such as this, as a very lay person, we may require to be sensitized. We are not experts in this. We need to be brought into the levels of awareness that's required. That if my child is suffering, I should not feel happy if my doctor is just on the face of it prescribing antibiotics. But I should be happy if the doctor is just looking more cautiously and the first pill that is coming in is not an antibiotics. I should be made aware. But why are doctors over prescribing this? What is the problem?
So, I mean, you're absolutely right that, while this has to be multi-pronged and while every stakeholder needs to be educated, it will definitely have to begin from the medical fraternity and doctors. There is a lot of overprescription because of the belief or just prophylactic thinking that even if I know this is a viral infection, I should give an antibiotic just to prevent a possible bacterial. Now, just to put these things into perspective, during COVID, less than 10% of the people with COVID actually had bacterial infections. But more than 85% of them received antibiotics, which means COVID is a virus. The antibiotics were not going to work against it, but they were still given antibacterials. So it needs to be very stringent. There need to be very clear guidelines for doctors, educated right from the primary healthcare level, not just the tertiary. The survey is tertiary, but it begins from the primary healthcare level, and alongside also making sure that there
is this somewhere a failure in our medical education system and training and experiences? Is this a failure really of what's happening in India?
So the medical training is fine. We learn all of this. This changes when the practice actually starts. Okay, and it's not just just MBBS. There are a lot of doctors, the other fields, where everyone prescribes antibiotics, and the doctors probably prescribe lesser percentage of it, but a lot of it goes over the counter directly from the pharmacy. Sardi khasi hui hai, ye 2 goliyan le lijiye. And quietly 2 antibiotic pills have been passed on, which means 1, it's not required. 2, it's an incomplete dose. And both of these are so important and so crucial in just creating AMR.
Right. Dr. Sanjeev, is, this whole thing about AMR-linked deaths, particularly in India as well. In fact, I'm sorry, I don't think I've gone to Dr. Rahul Pandit, so let me just go across to Dr. Rahul Pandit at this time. Dr. Rahul, How severe is this crisis? You know, we are talking about it. There's a survey which has come out, a small sample, but reflects the larger epidemic, if I may say so. I don't know if that's the right word. You could correct me on it. How severe is this crisis? If a Washington University study says that almost 1/3 of AMR deaths across the world seem to be from India, is this what's the larger picture? How severe is this crisis?
The crisis is definitely severe. There's no doubt about that. But it's just not about Washington University reporting deaths in India. If you look at MRSA deaths in the Western countries, you would equally find MRSA deaths in Western countries as well. So easy to point a finger towards India and say that this is going wrong. They are not looking into their own house. But we need to look at our own house. Let's not bother about other people. As an ICU specialist, I feel that when a patient comes to me right now, he's already received third generation antibiotics or cephalosporins or even carbapenems many times, even before they have actually come to the hospital. And what I'm
Please
increasingly
break
seeing,
that down for an ordinary person like me,
yeah,
sir.
so
And our
I was
viewers, please break that down for
so
us.
those are powerful antibiotics which are actually given for very severe infection. Like an ICU specialist or an infectious disease specialist would prescribe them for patients who have very severe infection in the body. But they have already received those
Right.
antibiotics even before they come to us. Now, what basically happens is that not only have they received antibiotic which was not needed and which was more powerful than what was required, if at all, there is an incomplete dose, there is an incomplete duration, and sometimes even an antibiotic which may not penetrate a particular tissue. For example, if I'm treating a urinary tract infection, I may have to take the drugs which will only penetrate the urinary tract infection properly. But sometimes they are given drugs which are not penetrating the urinary tract infection. We are just cultivating resistance because our gut is full of microbes.
All right.
And every time you take an antibiotic, you develop resistance. So that's the problem. Second problem is that
No,
increasingly I
and
am
it's a
seeing
very
in
important
ICU.
finding, which is part of the survey as well.
Yes, correct.
Dr. Rajiv, if I can just ask you at this point, do we have a picture of how many deaths, medical deaths for that matter, in India could be AMR linked or overdose of antibiotics linked? Do we have a picture about this?
I think that needs to be studied out, that actually how
Dr.
many
Rajiv?
patients who die of infection related problems actually had a multi-drug resistant organism. And that's just going to tell us whether it's a multi-drug resistant organism or not necessarily link it to overuse of antibiotic. We need to look at whether there is overuse of antibiotic or not. It's going to take a long time for this survey to run. So I think a prospective survey looking at a population for over 5 years or so will give you a very good answer of what is happening. A short survey or a snapshot is just going
Right.
to basically bring you with speculations, because animal industry uses antibiotics as well. That's a very important point which we all are missing. And a lot of people consume, people who consume dairy food or animal products are basically consuming a part of the antibiotic as well.
Dr. Rajiv, do you want to dwell on that a little bit? Then how does really one go? And I have to ask you this question. It's very interesting. My team and we were researching on this, and we actually saw Kerala being one of the states that seems to have started an operation for these raids that should be conducted in these medical shops, which if they're selling prescriptions, if they're selling antibiotics without prescriptions, at least one step looking at one part of the problem. But is India doing something towards this? Dr. Rajiv
Are you
Who is
asking
Jaydevan?
the
me?
question directed to?
Who's the question for?
Dr. Rajiv Jaydevan, please.
Couldn't hear you.
I'm sorry, I can't hear you.
All right, there seems to be some trouble. Dr. Rajiv Jaydevan, can you hear me?
Yes, I can hear you. Are you asking me? Yes. Okay. So there are measures taken by
That's right.
the government of Kerala to curb the over-the-counter use of antibiotics, and we doctors welcome it, because it's one thing to educate doctors about better antibiotic prescribing patterns, which they already know about, but the elephant in the room is really the rampant over-the-counter sale of antibiotics that occur between the consumer and the clerk who's at the counter, who's not even a pharmacist. That's the reality that happens in our medical stores. Now, let me give you some
Do you
perspective
see
about
any
how
such measures
medical
happen in
practices.
other states? Are there other things, other efforts?
I hope so too. But for our viewers, they need to understand a couple of basic things. One, newer antibiotics are not coming out in a pipeline. They're not. For the foreseeable future, we have to make do with what we have now. Now, if our present day antibiotics become useless for the present day infections, the doctors will be left with nothing to treat serious infections. Now, that really is the big picture here. So, on the one hand, as I mentioned, diligent
Right.
prescription is important, but on the other hand, not using antibiotics when there is a bacterial infection is also dangerous. For instance, a person who's reluctant to take an antibiotic prescription given out by a doctor can, in fact, have a problem with that. So this is a double-edged situation. So which is why I always say that an antibiotic prescription must have clinical thinking by a trained doctor behind it. Now, the doctor may
Right.
see a patient with fever and
Doctor-
based on his or her clinical judgment, decide that the patient has the features of a bacterial infection
Okay.
and go ahead and treat it. Now, the discussion here is about the level of antibiotic that the doctor needs to prescribe, and that is training that's been continuously going on through Indian Medical Association, through various CMEs, through medical colleges, to medical students, doctors, and so on.
Okay.
So that is going
All
on
right.
very well.
Doctor, let
and
me interrupt for
measures-
the lack of time. Let me just get on to Dr. Sanjeev at this point. Dr. Sanjeev, to just bring in another perspective, and this is a tough question, but I have to ask you this because one of the things that really comes to our mind, and for the lack of a better word, my colleague actually coined this word, pharmageddon, just to equal it with Armageddon. But, you know, pharma lobbying is a big, big deal as well. It is a reality, it's a challenge, it's a threat to the larger public health. How can you hold doctors accountable who are falling to this?
Yeah. So two quick points. One is, of course, the pharmacies have to be digitally tracked. We can't have a sale of repeat prescriptions, non-prescriptions of scheduled drugs to anyone and everyone. That's point number one. That's extremely important because community-acquired infections will continue to increase, which are multi-drug resistance. With regards to the choice of antibiotics in a hospital setting, either outpatient or in inpatient care, I think we have to choose our drugs wisely. We have to choose the drug depending upon the grade of infection and the system involved. There are many infections which are not going to work with particular grades and brands of drugs. And I think all doctors who are ethical will keep well away from these lobbies which may try to lure. But keeping that apart, I think we need a very, very sustained public awareness campaign, both for the doctors in the medical fraternity and for the public at large, not to use, not to abuse, and not to overdose yourself with antibiotics. It is going to cause harm not only to you, but to the rest of the community.
Dr. Trupti, I'm just possibly left with only 2 minutes. A very quick question to you. What do you want to leave as a message to the viewers? Have we reached a point where a doctor or a consumer have to face punitive action? Because nothing else seems to be working at this point. What's your advice to the government and to consumers who are watching you?
No, there is enough data to say that by 2050, antimicrobial resistance is going to be the biggest pandemic and the biggest killer. And we know it's going to come. It's, in fact, we are already in that pandemic. So we don't need any further warning, which means we need to put everything in place to stop it, be it education, be it legal action, be it educating each stakeholder, right from the pharmacy to the consumer. And of course, we will have to make sure that these laws are followed because we've come to a point that there will have to be laws, there has to be punitive action for wrongly prescribed antibiotics, for
Right.
Antibiotics are being dispensed. And the most important thing is the consumer definitely needs to be educated.
Right. Well, one thing is for sure, the basis of science is questioning for a very scientific attitude. And I think we've reached a time, or we've crossed that time in India and the world, where patients should just take anything from the doctors as the final word, question the doctors and doctors must question the patients. That perhaps could be a good starting point. I cannot thank Dr. Sanjeev, Dr. Rahul, Dr. Trupti, and Dr. Rajiv enough for joining us. I hope this has been something that has been able to get us thinking.
Thank you.
It's time for a short break. On the other side, we have more.